mentioned a bit in one of your previous answers about workforce being an issue. What is the government doing to strengthen the workforce in primary healthcare?
Look, there's a number of things we're doing to support the workforce in primary care. As outlined in the budget, we have a significant investment into a range of primary care actions in the primary care tactical plan. We've increased the number of doctor training places in our medical schools. We're providing up to 100 internationally trained doctors the opportunity to be able to train in primary care, supporting up to 50 domestic graduate doctors into primary care, incentivising primary care to recruit and support up to 400 graduate nurses annually for 5 years, improved access to advanced education for up to 120 primary care nurses, delivering up to 120 training places for nurse practitioners specialising in primary care. So there's a range of initiatives that we have underway to support the workforce in primary care. But I said earlier, it's also that additional investment which Health New Zealand will be making to ensure that primary care is well funded so that it is able to continue to be more accessible to patients.
Have they got
which is
jobs waiting for them when they come out?
Supplement, thank you, Mr. Chair. In terms of the international medical graduates, are they tending to go into the regions or into the urban areas? And if they do go into the regions, what kind of support is there available for them? And is their effectiveness being modelled?
Yeah, so that's a really good question. 2 points on that. Firstly, yes, the regions will be part of that. In fact, there was a trial last year. Waikato was the first region which trialled it. And the support around that is a really important part of what Health New Zealand is delivering. We've had a number of conversations with Health New Zealand and also the New Zealand NZ REX doctors. We've had some workshops with them to actually talk about that particular issue because that is an issue they've raised around the support that's required. And it's an area that I've asked Health New Zealand to continue to focus on so that they are well supported through that training process.
Thank you. I'll go to the final for the primary.
Thank you. Minister, you said on the weekend that you're repealing the health charter and sector principles to reduce red tape and make things clearer for everyone. I just want to refer to the health sector principles that talk about equity, equitable levels of service, equitable health outcomes, that the health sector should provide a choice of quality services and developing and maintaining a health workforce. How is this not clear? Why are we repealing this very key part of the legislation?
The New Zealand Health Charter, which was put in place under the previous government, doesn't mention the word patient once. Doesn't mention the word patient once. It mentions unions 11 times. Doesn't mention patients once. My focus is very clear. Putting patients first, delivering for patients. And so if you look at those health sector principles, one of them is requiring the health system to deliver against like climate change obligations. We have a ministry for the environment for that. I want surgeries, not strategies. I've been very clear about my focus is on patients, reducing wait lists, the 5 health targets, and we need to unclutter the system so that the system can deliver more for patients. And that's why we are making those changes in legislation, which will shortly come before the Select Committee.
Minister, what do you say to those in public health and population health that argue that we need to have targeted approaches across those populations most impacted? What do you say?
And we've been very clear as a government, where there is a need, we will invest. And that's where, last week I announced the extension of the immunising our tamariki initiative, which is an initiative very much focused on immunising Māori children, because that is an area where there is a significant need. And so the health targets are about highlighting the need and highlighting where the focus needs to be, and where there is a need to invest to address population inequities. Health New Zealand will deliver on that based on the need.
The health sector principles, Minister, reflect the recommendations of the Waitangi Tribunal on Y2575. Are you turning your back on the recommendations of the Waitangi Tribunal by repealing and removing the health sector principles?
I'm focusing on patients. And as I said, the delivery of that is simply
patients
a document.
Are whānau, patients are community.
Well, it's a document which doesn't even refer to patients. There's not the word patient, doesn't even feature once in the document that was produced. And so I'm putting patients first, focusing on outcomes. We have 5 health targets, and we want to make sure we're improving health outcomes for both Māori and non-Māori, for all New Zealanders, through the delivery of the services that Health New Zealand provides.
Okay, so let's unpack that, because you've referred to improving services for Māori. You're relegating iwi Māori partnership boards now to what community whānau voice. What happens to the plans that have been commissioned and developed locally? You're elevating the HMAC, the Hauora Māori Advisory Committee, above and beyond the iwi Māori partnership boards. Why?
Well, we want to make sure that the advice that the iwi Māori partnership boards flows through to the Hauora Māori Advisory Committee, and that advice can then be provided to the Minister or the Health New Zealand Board to consider the advice. So it's about actually enhancing the role of HMAC, streamlining the advice that is brought forward, and ensuring that those voices are clearly able to be represented. But at the end of the day, we want to improve health outcomes for all New Zealanders. We have 5 health targets which are incredibly clear, and our focus is on delivering against them.
And so the iwi Māori partnership boards...
Come through the chair, please.
Mr. Chair.
And then we'll go to
Iwi
Aisha
Māori
after this.
partnership boards are seeing their power stripped back. They will no longer have a strategic commissioning function. Are they going to be monitoring the system anymore? Or are they just community whānau voice?
They will
Where
be
are they being
providing,
placed?
they'll be providing the views and the areas which need to be focused on and providing that advice up through the Hawera Māori Advisory Committee. That legislation will shortly be before the House, and this committee will have the opportunity to consider it.
And in closing,
Not to veer off subject.
in closing, the Hawera Māori Advisory Committee, there is no information on this group online. The Public Health Advisory Committee, you can see their work plans, you can see their minutes, you can see their board packs. What is the terms of reference for the Hawera Māori Advisory Committee? And when will we be able to see what they're actually doing tangibly to improve Māori health outcomes?
Yeah, and they've provided a number of reports which I believe are available online, and we're happy to
Cannot see them.
happy to provide that
Where are their
information.
minutes?
Come back to you on that.
Okay.
Majority.
Sorry, I laughed when he said, I want surgeries, not strategies. I'm like,
He,
Oh my
he said that
God.
way earlier too. He's like, the last government focused on strategizing. It's like,
Like,
what?
wow.
Well, I mean,
this is
do you
a
want
line.
to sit down there and have say, let's get someone under surgery? They're meant to be going in to have their appendix removed and suddenly have their ovaries removed and can't produce children, which goes against the wishes of what the patient wanted. Is
Yeah,
that
but they
At
want
least
surgery,
they
not
got a
strategies.
surgery at least, though.
Yeah, what's the surgery?
yeah.
You
But
don't
you
need
know,
to meet the freaking targets.
like, is that what he's trying to mean? Because like the whole point of like having strategies is making sure that you actually have a plan to go in place. I mean, do you want to sit down there and have an HCA as your anaesthetist?
Oh, shit.
I mean, knowing Simeon,
Oh.
he probably would sit down there and give the thumbs up to that, simply
Yes,
because he was
yes.
in the cost of an HCA being cheaper than a well-paid anaesthetist.
We are so fucked. Oh my god. All of a sudden, he just forgot about the nursing hiring freeze as well.
Yeah, that probably was a bit convenient.
It's like, oh
There's
yeah, we got
there's
all...
no hiring freeze. There's no.
No,
hiring
there's no,
freeze.
there is no hiring freeze. You know,
There's
all
no
these
hiring
nurses
freeze.
and doctors leaving for Australia, that's not happening.
I mean, every internal memo basically says there is a hiring freeze, but
Yeah.
officially there's no hiring freeze.
No.
And
They say
probably-
many
but
things
the
about
people who
Australia
work
that
in
I
the
disagree
hospitals
with.
or the politicians. Who are you going to believe?
I mean, I wonder if we'll have a new health minister within the next 12 months.
Oh, really?
Ugh.
All right.
Well,
Oh
you
my
never
God.
know. I mean, is Simeon really up to the job?
No.
No, he's not. He's
No.
definitely not. But
No.
the last guy was like a certified doctor. He was up to the job, and he got kicked.
Yeah.
Because he couldn't sit there and do the nasty things because it went against his Hippocratic oath.
Here's the problem with Shane Reti. He tried to do strategy and surgery. Simeon Brown just wanted the surgeries. He didn't want the strategies.
Yeah, he gets lots of bark.
And say what you want about Siguriti. Like he didn't play silly semantics games. He didn't sit there like I never saw him do the whole blame labor.
No,
or
he
anything like
didn't.
that. Like he was quite he's quite upfront. I think in a lot of his conversations. Maybe that's why they got rid of him.
Yeah,
You're too
yeah.
honest.
Too honest, yeah.
Yeah, that's the problem. It's like you don't even give him a truth, Professor Snape's truth potion, and he's already telling the truth.
Now, who was
Exactly.
that Jenny Maycroft? Was it her that asked what about rural nurses?
Yes,
But she
yes,
actually-
yeah. Which
a question.
yeah. Remember, Jenny Marcroft is a sensible New Zealand First MP.
Yeah, no, she actually asked a good question. Yeah, what about the rural nurses? What money has been put forward to help people from rural communities go and study nursing and go study to be a doctor? Because generally, I mean, I have looked at the sociological data around this. Is that normally you want to train people from a community to go work back in that community because they tend to return. Unfortunately, what's happening is because doctors are so underpaid and overworked that they're going off to Australia.
And they're going to go to the communities that they came from. So they might go to the Sydneys. They might go to Alice Springs instead of returning to Masterton.
Yeah, they go to a parallel community that offers better pay.
Yeah. When I think of Alice Springs, it's a place that's in the middle of nowhere in Australia.
Yep.
Or maybe
But they're
Darwin.
training nurses. Don't worry, they're training them.
They're
They just
training
don't have
nurses,
yeah, they just can't guarantee they'll have anything when they.
They won't stay,
graduate.
no.
No.
Yeah.